Corticosteroids, commonly known as corticoids, are widely used to treat inflammatory, allergic, and autoimmune conditions. While these drugs are highly effective in managing various medical conditions, their prolonged use or excessive dosage can lead to severe side effects, with gastric ulcers being one of the most concerning complications. Despite their therapeutic benefits, corticoids pose significant risks to the gastrointestinal tract, making it essential for users to understand the mechanisms behind their harmful effects and take necessary precautions. Gastric ulcers occur when the protective lining of the stomach is damaged, leading to painful sores that can cause discomfort, bleeding, and, in severe cases, life-threatening complications such as perforation or massive hemorrhage. Corticoids contribute to this condition through multiple mechanisms. One major factor is their ability to inhibit the production of protective prostaglandins in the stomach lining. Prostaglandins play a crucial role in maintaining the integrity of the gastric mucosa by stimulating mucus and bicarbonate secretion, which act as a barrier against stomach acid. When corticoids suppress prostaglandin synthesis, the stomach becomes more vulnerable to acid-induced damage, increasing the likelihood of ulcer formation. Another harmful effect of corticoids is their tendency to increase stomach acid production. While these drugs are not as directly acid-stimulating as some other medications, they can still elevate gastric acid levels over time, creating an environment that accelerates mucosal erosion. This effect is particularly dangerous for individuals who already have predisposing factors, such as a history of gastritis or previous ulcers. Furthermore, corticoids can impair the body's ability to heal existing gastric injuries by suppressing cell regeneration and reducing blood flow to the stomach lining. This delayed healing process means that even minor damage to the stomach mucosa can progress into a serious ulcer if left unchecked. The risk of gastric ulcers associated with corticoid use is significantly amplified when these drugs are taken in high doses or for extended periods. Chronic users, especially those on long-term steroid therapy for conditions such as rheumatoid arthritis or autoimmune disorders, are at the greatest risk. Additionally, older adults are particularly vulnerable due to age-related weakening of the stomach lining and reduced regenerative capacity. Patients who use corticoids in combination with non-steroidal anti-inflammatory drugs, NSAIDs, face an even greater danger, as NSAIDs themselves are notorious for their ulcerogenic effects. When used together, these medications create a synergistic effect that dramatically increases the chances of severe gastrointestinal damage. Several other pain-relieving medications can also contribute to gastric ulcers, compounding the risks associated with corticoid use. Aspirin, a commonly used drug for pain relief and cardiovascular protection, is well known for its ability to cause stomach lining erosion, leading to ulcers and gastrointestinal bleeding. Ibuprofen and other NSAIDs such as naproxen and diclofenac also pose similar threats. These drugs inhibit cyclooxygenase (COX) enzymes, which are involved in prostaglandin production, further stripping the stomach of its natural defenses against acid damage. Many individuals unknowingly exacerbate their risk by taking corticoids and NSAIDs together without medical supervision, increasing their chances of developing severe gastric complications. Given these risks, it is crucial to take preventive measures when using corticoids to minimize the likelihood of gastric ulcers. Patients should always use these drugs under strict medical guidance, following prescribed dosages and treatment durations to avoid unnecessary exposure to harmful effects. In cases where long-term corticoid therapy is necessary, doctors often prescribe additional medications to protect the stomach lining, such as proton pump inhibitors, PPIs, or histamine, two receptor antagonists, which help reduce stomach acid production and provide a safer environment for gastric tissues. Diet and lifestyle modifications also play a crucial role in ulcer prevention. Individuals taking corticoids should avoid foods and beverages that irritate the stomach, such as spicy dishes, acidic fruits, alcohol, and caffeine. A well-balanced diet rich in fiber, lean proteins, and anti-inflammatory foods can support gastric health and enhance the body's ability to counteract ulcer formation. Additionally, maintaining regular medical checkups is essential for early detection of gastric issues, allowing for timely intervention before complications arise. Despite their effectiveness in managing various medical conditions, corticoids remain a double-edged sword due to their potential to cause severe gastric damage. The risk of ulcers and gastrointestinal bleeding should never be underestimated, and patients must be proactive in taking the necessary precautions. Awareness of these risks enables individuals to make informed decisions about their treatment and prioritize their long-term health. Anyone using corticoids should remain vigilant for warning signs such as persistent stomach pain, nausea, vomiting, or blood in the stool, as these could indicate serious complications requiring immediate medical attention. While corticoids offer undeniable benefits, their misuse or careless administration can have devastating consequences, making responsible use a critical aspect of their effectiveness and safety.